Hello and welcome. Today we are going to be demystifying a really fascinating technology that's offering a whole new kind of hope for mental health. It's called Transcranial Magnetic Stimulation, or TMS for short. So let's jump right in and find out what makes it so different.
For millions of people, this isn't just some hypothetical question. It is their daily reality. When the traditional treatments for depression just aren't providing any relief, it can really feel like you've hit a wall, like you've run out of options. But what if there was a completely different approach, one that targets the brain directly, without medication?
And that's exactly where TMS comes in. It represents a totally different path to relief because it targets the biological roots of depression in the brain, but without all the systemic effects that can come with medication.
Okay, so this slide really gets to the core difference. Think of it this way. Traditional antidepressants are systemic. You take a pill, it goes into your bloodstream, and it travels through your entire body. And that's often why you can get those widespread side effects. TMS, on the other hand, is focalized. It is a super targeted treatment that works directly on the specific part of the brain that regulates your mood, and it pretty much leaves the rest of your body alone.
So how in the world does it actually do that? I know it sounds like something straight out of science fiction, but the science behind it is surprisingly straightforward. Let's break down how these magnetic pulses actually get the job done.
The really crucial point here is that TMS is non-invasive. There are no needles, no surgery. A specialized coil is just placed on the scalp, and it delivers these gentle magnetic pulses, not electricity, to stimulate nerve cells in the prefrontal cortex. You can almost think of it like it's gently waking up the part of your brain that's become underactive because of depression. All right, let's clear something up right away, because this is a really common point of confusion. When people hear brain stimulation, a lot of minds jump to shock therapy or ECT, but honestly, they are worlds apart. With TMS, you are completely awake, you're alert, it uses magnetic fields, and there's no anesthesia involved at all. ECT, on the other hand, uses electricity to actually induce a seizure, while the patient is under general anesthesia. So yeah, they are fundamentally different treatments.
Okay, so we've covered the what and the how. Now let's get to probably the most important question of all, the who. Is this treatment actually the right choice for you?
Generally speaking, a good candidate has a formal diagnosis of major depressive disorder. And, this is a big one, they haven't found relief with at least one antidepressant, and often it's after trying multiple types. It's also a fantastic option for anyone who just can't tolerate the side effects of medication and is really looking for a non-invasive alternative.
And of course, there's always the practical side of things, the cost. So will insurance cover this? Well, the good news is that the medical community now widely recognizes TMS as a standard of care, and insurance companies have definitely started to follow suit.
So yes, most major insurance providers do cover TMS, but, and this is an important but, they almost always require proof of what's called medical necessity. Basically, this just means your doctor needs to provide a really detailed, documented history showing that you've already tried other treatments and that unfortunately, they just didn't work for you.
So let's say you and your doctor decide this is the right path forward. What does that journey actually look like? Let's walk through the entire process, from start to finish, so you know exactly what to expect, no surprises.
That very first session is usually the longest, and it's because of a really key step, finding what's called your motor threshold. I know it sounds technical, but it's actually pretty simple. A clinician uses the coil to find the absolute lowest magnetic energy level that causes a tiny involuntary twitch in your thumb. This little step is so important because it personalizes the treatment intensity specifically for your brain, making sure it's both safe and effective. And that mapping we just talked about, it's all part of a very structured process. As you can see, it all starts with a consultation. Then comes the mapping. From there, you'll plan out your daily sessions. And all along the way, your provider will be tracking your progress. And then finally, you'll enter a tapering phase where the sessions just become a little less frequent. So, what does that time commitment really look like? Well, a standard full course of TMS therapy usually involves about 36 sessions. This is typically spread out over 6 weeks of daily treatments, Monday through Friday, followed by a 3-week taper. Consistency is really the name of the game here.
All right, let's get to the bottom line. We've talked about the what, the why, and the how. Let's finish up by looking at what you can really expect from the treatment, the results, the risks, and the day-to-day realities.
So, what does it actually feel like? Most people describe it as a repetitive tapping or knocking sensation right on their scalp. It might feel a little strange or uncomfortable at first, but almost everyone gets used to it really quickly.
And here's a huge plus. There is absolutely zero recovery time. You can drive yourself home or go right back to work or whatever you were doing immediately after a session.
The most common side effects are pretty mild, things like a tension headache or some discomfort on your scalp right where the coil was. These usually fade pretty quickly after the session. But what's really important is what's not on this list. You know, those systemic side effects that often cause people to stop taking antidepressants, things like weight gain, sexual dysfunction, or that feeling of sedation. TMS avoids all of those.
Now, we have to talk about the most serious potential risk, which is a seizure. It's really important to address that head-on. But the risk is incredibly low. With the proper screening beforehand, it happens in less than 0.1% of patients. That makes it an extremely rare event.
Something you should know is that not all TMS providers are created equal. It really pays to look for a clinic that follows what's called an advanced protocol. This just means you're doing more than the bare minimum. Things like remapping your motor threshold periodically, using more advanced coil technology, having a clinician right there on site, and tracking your symptoms weekly instead of just once a month.
And what about after the treatment is done? How long does it last? Well, for many people who respond, the positive effects can last for a year, sometimes even longer. It's probably best to think of TMS not as a one-time cure, but as a really powerful tool to manage depression. And if symptoms do start to come back down the road, maintenance sessions can be used to get you right back on track.
Which brings us to our final question. When you think about its ability to target the specific biology of the brain in such a non-invasive way, is TMS giving us a glimpse into the future of how we treat mental health? It's really this incredible marriage of physics and psychiatry, and it's offering a whole new kind of hope and a new path forward when all the other roads seem to